The advantage of a Tele-ICU is that they simply turn on the audio-video system and they're at the patient's bedside.
So we'll see how the fluid bolus works. We'll give him a few minutes. If his blood pressure doesn't respond, then we'll give him a low-dose epinephrine IV push. Yeah, and he doesn't look like he's breathing real well, so can you call respiratory therapy to the bedside?
If we could grab the ambu bag and assist him with ventilation until respiratory gets his ventilator. Diana, great job. The ICU doctor's on their way, and we'll continue monitoring until he arrives.
I'm Dr. Jonathan Seiner. Welcome to the Inside Tele-ICU at Yale Medicine. Hi, Robin. Just noticed the blood pressure was low, systolic of 50s in one of the patients in room 310 at the medical ICU at St. Raphael's campus.
Hi, I'm Robin Waddell. I'm a nurse practitioner here at Yale. I've been in the Tele-ICU since August 2015 when the program launched.
The Tele-ICU is a way of providing care remotely to critically ill patients using two-way audio, video, and remote monitoring of data. Really a second set of eyes and an added layer of protection for the patients. The Tele-ICU operates from 7 p.m. to 7 a.m.
The patients, the families, and the nurses can see me on a dashboard screen in the room, and we're able to communicate the plan and update the family as needed.
The core of the operations is a list right here, and this list has all the patients that we're monitoring in the ICUs at St. Raphael's campus, the emergency departments at the York Street and St. Raphael's campus, as well as the medical surgical ICU down at Greenwich Hospital. The current technology and build in the Tele-ICU allows us to care for 56 patients at present, but we could easily expand it to 120 patients. Can we check in with the nurse and turn on the display?
This is Robin, the nurse practitioner with Insight. Can I turn the camera on?
Yes, this is Diana.
Okay, good.
Systolic still in the 50s. In the old days, you would review your trend of your vital signs, and it might have happened an hour ago.
Tele-ICU looks at all the data available in the electronic medical record, as well as all the vital sign and other data coming in from the bedside monitors. So their oxygen level, their blood pressure, their heart rate, their respiratory rate, as well as the cardiac rhythm from the electrocardiogram. The way the scale works, a big change in blood pressure would bump the patient way up to the top of the list immediately, and they go from a green to a red right away.
If they see any change in a vital sign, they immediately notify you.
Mobile Heartbeat is an app on the phone that is secure. So we're able to communicate about patients,
If you want to come back from the emergency.
and they're able to contact us. We carry the phones all the time. Dr. Bernard's arrived to put the central line in.
We'll keep the camera on, and so if there's any management that you need help with while you're doing the procedure.
Just for a recap, we're bagging him and we'll place him back on the ventilator. If you need anything else from us, just let us know. We're available. I'm gonna camera out.